But what also we do is to encourage and go to schools, speaks to students and make them aware of what radiation oncology is about. Why is it important for doctors to specialize?
Let's talk about that. I'm going to slow you down for a second.
Yes.
Okay. So let's talk about radiation oncology, right? I think before I do that, Derek had a question. He was trying to ask it in the last, Derek Peralta, my new intern here at WHCR.
like him so much. He's fascinating.
Yeah, I have to slow him down too. He want to be the host, but we're going to train him how to be that, right? So we're going to work with that. So, Derek, ask your question first.
So, doctor, last week, I asked you, about your origin story, but we only had 30 seconds left, and I felt like that was a too little origin story. So, do you mind expanding upon your origin story, like what you were saying last week?
Okay, you asked me a question as to what made me become a doctor in the first place. Then we'll ask why I focused on radiation oncology. You would remember that South Africa comes from a very sad background of apartheid, and a lot of people, there was decentralization, a lack of decentralization of resources. Hence, I watched my grandmother die because the ambulance could not come to my community because of roads. I watched people die during the uprising when Mandela was in jail. Remember, when he was in jail, there was a struggle and a fight in the community. And all those people, when they died, you wish you could help. So I developed that love for medicine, and there was no doctor in my community. So I worked hard and tried to pass, and I became the only student to pass in my school, higher grade mathematics and physics. Then I was able to get into medical school. But a lot of things that we become, if I can just briefly say, we become who we are because of our environment. Our environment sometimes groom you to become the person that you are. My environment encouraged me to become a doctor. And why oncology? Patients, when I was in medical school, around fourth year, third year, they would see me wearing a lab coat going to medical school. Because my community had not seen a doctor, they thought, I am a doctor already. Yet I wasn't a doctor at that time. So they will come to my mother's house queuing for me to help them, yet I was not qualified to become a doctor. I had to find a way to help them, hence I had to start the organization which we call Sinomusa no Tando, means we have love, care and generosity, because it began in my village. And that love for dealing with cancer patients, cervical cancer patients, I'm happy we've got a cervical cancer survivor today, an amazing lady, Travis.
Yes.
Cervical cancer patients in my community, Travis, they are dying because the waiting period for radiotherapy is about 1.5 to 2 years after they're diagnosed. So that made me fall in love with radiation oncology. Then I became the first Black in my state, which had about 12 million people, to specialize in radiation oncology. I was not welcomed. I was of a brown skin, and yet everybody was of a different skin color. I was not allowed to sit in with other doctors of the white original in. I fought until I paved the way for myself, and not just for me only, but for also other African doctors. We spoke a lot about that.
I want to go directly to now, while we have the time, talking about radiation oncology. I know you were talking about some of the options available for people who may have cancer or have cancer, particularly cervical cancer you were focusing on. Let's talk about what treatments are available. What are those options?
Okay, radiation oncology is a field of oncology, which oncology on its own is a bigger picture. There's surgical oncology. So every part of medicine has oncology in it. If there's an orthopedic surgeon, there will be an orthopedic surgeon focusing on oncology. So those are not dealing with radiation, they're dealing with their skills. Like surgical oncology will be operating the breast or will be removing that womb that has cancer. Then they refer to a medical oncology who gives chemotherapy, and a radiation oncology who uses radiation to treat. So I hope everybody gets the picture. So if you have cancer, you are most likely to see more than 3 or 4 doctors within your treatment time. So types of cancer treatments that are available for patients